Persistent muscle weakness is a common issue people encounter after surgery and can derail your progress. But here's the thing, there are strategies you can use to help speed up muscle recovery. The use of neuromuscular electrical stimulation, or NMES, has been shown to be a useful way to prevent muscle strength loss, particularly in the first 8 weeks after surgery. This can be key to minimizing the deconditioning of the muscles and help speed up your recovery. So in this video, we'll demonstrate how you can utilize neuromuscular electrical stimulation at home so you can optimize your outcomes. Hey everybody, welcome back for another episode of physioshow where we answer all of your rehab-related questions. Now you may be wondering about the difference between electrically stimulated muscle contractions and voluntary muscle contractions that you initiate yourself. Well, one key distinction lies in the sequence of motor unit recruitment. When you voluntarily contract your muscles, such as during exercise, the process typically starts with activation of slow twitch type 1 muscle fibers, known for their endurance and resistance to atrophy. These fibers are crucial for sustained activities and exhibit a slower rate of deconditioning post-surgery. In contrast, large diameter fast twitch type 2 muscle fibers are essential for generating powerful and forceful muscle contractions, providing our bodies with the strength and power needed for various movements. However, these type 2 fibers tend to atrophy more rapidly after surgery, which is something we aim to prevent. Neuromuscular electrical stimulation devices help address this issue by targeting these powerful type 2 fibers early in your rehab. By stimulating these fibers, NMES aims at preventing their atrophy and enhances your body's ability to produce forceful muscle contractions. And just to clarify, this is an NMES device, not a TENS device. While both use electrical stimulation, they serve different purposes. NMES focuses on restoring muscle contractions, while TENS is mainly for pain relief. So if your goal is to address muscle weakness and enhance contractions, ensure the device you buy has NMES functionality. I have provided the link to the unit I'm using in this video in the description below if you would like to check it out. Now that we understand the primary goal of NMES, let's talk about how to set it up at home. The units nowadays are inexpensive and easy to set up, and once you get used to how to punch in the settings, you'll be able to get this treatment going in just a couple of minutes. But before we fiddle around with the device, we must first set ourselves up for the treatment. We need a belt and a standard chair. Sit down in the chair with the operative leg extended slightly, around 60 degrees, with the foot flat on the floor. Wrap the belt loosely around the legs of the chair and around the shin of the operative leg. Tighten the belt so there is minimal slack. The belt will provide resistance against the leg's contraction, which you'll experience when the device is activated, as you'll see shortly. You want to place the pads on the lower inside part and upper outside part of the front of your thigh. Plug in the leads to the pads and then hook up the leads to the device. Once you turn on the machine, you're now ready to punch in the specific settings to promote muscle contraction and get the benefits of the device. We will then adjust the on time, which is how long the device is on when it activates. Because we are recruiting powerful type 2 muscle fibers, these fibers tend to fatigue quickly. For this reason, we will be utilizing a longer rest break between stimulated muscle contractions when using the NMES device. So we will set the machine to on for 10 seconds at a time and off for 50 seconds. Next, we will set the pulse width, which determines the length of time that each electrical signal is applied through the skin. The higher the pulse width, the more intense the stimulation. We want this all the way up to get a forceful muscle contraction, so let's set this to 300, which is the maximum for this specific device. Next, we will be setting the pulse rate, which is the setting for how many electrical impulses are applied per second. We will be setting this to 75 Hz. Now to set the duration of the treatment, we will set this to 15 minutes. So with a 10-second on time and a 50-second off time, that will result in a total of 15 contractions, or 1 contraction per minute. Okay, now the machine is set and ready to go. It's time to ramp it up. Now I'm gonna warn you, this is not comfortable. We want this machine turned up as high as you can tolerate, because the stronger the contraction, the better the recruitment of those important type 2 muscle fibers. Now I suggest turning this machine up gradually just to ease into it, but again, it needs to be high intensity. Otherwise you're not going to get the benefit. So I'm gonna turn it up to its highest setting. Now as you ramp it up, you're going to notice your leg will start to contract on its own. As you can see, my muscle starts to contract and push into the belt. I am not doing any of this. This is 100% being done by the device. The contraction will last for 10 seconds and then it will shut off at 50 seconds. It will continue to turn on and off for 15 minutes. I suggest you get your phone out or watch something on TV to pass the time and take your mind off the intense contractions. Once it's done, shut off the machine and unhook yourself until the next session. It's recommended this treatment be performed 3 times a week in conjunction with regular physical therapy, focusing on flexibility and other strength exercises. As always, you should consult your physical therapist prior to using this device so they can tailor the treatment to your specific needs. Well, I hope you enjoyed this episode of Physio Show. Make sure to hit that like button to help support the channel and consider subscribing so that you can stay up to date on everything you need to know about your body, how it works, and what it needs to keep moving.